Hello everyone, welcome back to my YouTube channel. So in this video we will be discussing about the anatomical directional terms. As we all know, anatomy and physiology is one of the toughest subject from the point of view of the student. As a first year student, I saw many of the first year students, they complain that the anatomy and physiology is one of the most toughest subjects. So let's make it a easy one. So we will start with the basics of anatomy and physiology. So we are going to discuss about the anatomical terms or the anatomical directional terms. So what are anatomical terms? Anatomical terms help us to identify the location of both internal and the external body structures. Okay, in anatomy mainly we are studying about the structure of the organs of the human body. So while we are talking about the structure, these directional terms and the anatomical terms will be very much helpful. If our means these are the basics of the anatomy. While we are studying the anatomy, the anatomical terms and the directional terms are the basics. So if our basics is clear and strong, automatically the anatomy subject will be easy for us. So anatomical terms, mainly these are helpful while we are studying about the structure of an organ, either it is the internal structure or the external structure. Okay, next, these are identify where something is located on the body relative to another body part. So why we are using the directional terms? So direction means these are telling us about a particular direction. So directional terms mainly we are using in order to identify or decide what is the location of a particular organ in reference to the another one. Suppose lungs and heart is in thoracic cavity. So what is the relationship between lungs and heart location? Means where the lung is located while we are comparing it with the heart, and where the heart is located while we are comparing it with the lung. So today we are going to discuss about all these things. So let's start the class. Learning anatomy is similar to building a house. If the foundation is strong, then it will be last for a lifetime. As I already told you, it is one of the toughest subjects. So if our basics are clear, then automatically we will be master in this anatomy. So it will be memorable or for us for the lifetime. This subject is definitely difficult and filled to the brim with the details, but the basics keep cropping up time and time again. So if our basics are clear, so automatically everything will be clear while we are studying about the anatomy. So you will be constantly use them as a reference when learning new anatomical concept. Thus mastering the fundamental is very much essential. So anatomical directional terms are the fundamental of the anatomy. Means in order to understand the core concept of the anatomy, we have to understand about the directional terms. Okay, here you can see one structure. Here one man, you can see a muscular man is standing. So if we will see the position how the man is standing, okay, so we can easily see the man is standing upright, and the arms are away from each other, and the hands are means palms and fingers of the hands are forward. At the same time feet are also away from each other, but the feet's direction is forward and face is also forward. So this is called the anatomical position. Yes, this is only the position in which we can easily identify the directional terms. So what this position exactly is? Anatomical terms used to describe location are based on a body position in what is called the standard anatomical position. So this is only the position in which we are going to study about the different directional terms or the anatomy of the structures. So this position is one in which a person is standing upright. So here you can see this person is standing upright, not he is in lying position or not he is in sitting position. So standard anatomical position is always the man or the person will be standing upright. Next, with the face forward, you can see the face of the person is forward, arms are at side, palms facing forward, feet together and forward. Okay, so this is the anatomical position which we are using in order to study the anatomy of particular structure or the organs. So while we are doing. Okay, all the structures and all the face and extremity of the person is in the same direction, so how it will be helpful if everyone is looking at the body parts in exact same position, so there will be less confusion when discussing about the anatomy. Means all the structures, they are looking at the same direction. Face is in forward direction, and the palms are also in forward direction, and the feet are also in forward direction, so it will be easy for us to understand the anatomy of the structures, and it will be less confusing. So to compare the location of the body parts related to each other, anatomy uses some universal directional terms. So as today class will be all about the universal directional terms. What are they? Left, right, anterior, posterior, ventral, dorsal, distal, proximal, medial, lateral, median, superior, inferior, external, internal, superficial, and the deep structures. So let's start with the left and right. Left and right is very simple funda. Means as if I will see, means if I am an observer and I am going to observe a patient, so okay, so according to me it will be the right side, and according to the picture it is picture of me, means observer picture, so it is the right side of the observer and it is the left side of the observer. But if we will talk about the patient, so it will be opposite. Our right side will be the left side of the patient and our left side will be the right side of the patient. So how we will correlate this? With the help of an example. So when we will talk about any structures, like in first structure you can see the body is the midline of the body is umbilical. So if the patient is saying that he is having some ulcer and the pimple at the left side, so automatically we will say that the pimple is at the left side of the umbilical. But if that pimple and ulcer is at the right side of the body of the patient, so automatically we can see the ulcer or the pimple is at the right side of the umbilical. Okay, so let's move to the next picture. So this is the internal structure. So this is the structure of the large intestine. So if we will talk about the left and right side of the large intestine, so if we will see, we will say that the descending colon is the left part of the large intestine and ascending colon is the right part of the large intestine. So by left and right we will identify the location of the structures and where the structure is exactly located. Okay, next we will move to the anterior and the posterior. So anterior and posterior, it's very simple. Anterior means when we are seeing from the front side. So there are two pictures. In one picture we can see the face or the face side of the patient, and other picture we can see the back side of the patient. So when we are talking about the front side, it means anterior. Okay, so directional terms which we are using for the front side is anterior, and the directional term which we are using for the back side is the posterior. Okay, so sometimes instead of anterior and posterior we can also use the term ventral and the dorsal. Okay, so when we will talk about the anterior side, it means we are talking about the ventral side of the structure, or if we will talk about the posterior side, it means we are talking about the dorsal side of that particular structure or the body of the patient. So let's take one example. We know nose and ear. Okay, so nose is in the face part and the face part is in front, so it will be anterior. Okay, on ear, if we will compare the position of ear with respect to the nose, so we can say that nose is anterior to the ears and the ears are the posterior to the nose. Let's understand it more with one more example. Here you can see two internal structures, sternum and the heart. So when we will discuss about what is the relationship between the location of the sternum and the heart, so we can say that sternum is anterior to the heart and heart is posterior to the sternum. As when we will see the anteriorly, first we will be able to see the sternum, and when we will see from the back, first we will be able to see the heart. So we can easily say sternum is anterior and the heart is posterior to the sternum. Okay, next one is the superior and the inferior. So superior, as the name suggests, superior means it will be on the top, inferior means it will be on the bottom. So if we will talk about the body structures, so superior will be which are above or upper or towards the head side. Okay, the structures which are towards the head side of the body of the patient are superior, and the inferior means which are lower or below or towards the feet, means the structures which are near to the feet of the body, that structures are inferior. So one example we will take here. So when we will if we will talk about the what is the directional term relationship between abdomen, chest and the pelvis. Okay, so abdomen is in middle, chest is above abdomen and pelvis is below abdomen. So here we can say abdomen is superior to the pelvis, okay, and inferior to the chest, okay, as abdomen is, okay, abdomen is above the pelvis, okay. So we can easily say that abdomen is superior, but it is below the chest, so we will say the abdomen is inferior to the chest, okay. One more example we will see, internal structures. So heart and small intestine, so easily we can see the heart is near to the top side and small intestine is near to the bottom side. So we will easily say that heart is superior to the small intestine and small intestine is inferior to the heart. It's very simple. Next, medial and the lateral. So while we are talking about the medial and lateral directional terms, first we have to draw a midline which will divide the body into two equal halves, okay. So when the body has been divided into two equal halves, so the structures which are near to the midline, it will becomes under medial, and the structures which are away from the midline, that will come under the lateral. So what is medial? Exactly towards the midline of the body or related to the midline of the body. And what is lateral? Towards the side of the body structure farther from the midline is referred to as lateral. So one simple example we will see between little finger and the thumb, okay. So as means it is according to the how the patient is standing. Patient will be in front of us, so right side of us will be the left side of the patient and left side of us will be the right side of the patient. So according to the patient we will see, so little finger is medial to the thumb and thumb is lateral to the little finger. One more example we will see here. So if we will talk about the lungs and the heart, so we know the location of the lungs and the heart. So what is the relationship between them on the basis of the anatomical directional terms? So lungs will be lateral, okay. We can see that the heart is in middle and lungs are lateral or away from the midline of the body. So lungs will be lateral to the heart and heart will be medial to the lungs. Next, proximal and the distal. Okay, the proximal and distal. In order to understand this, first we have to understand or talk about the axial body and the appendicular body. So generally body is divided into two, axial body and the appendicular body. In two structures you can easily see. If we will talk about the axial body, it will be including the trunk and the head portion of the body, and if we will talk about the appendicular body, it will be including the extremity, including upper and the lower extremity. So let's come back to the proximal and the distal. So the proximal will be towards the axial body, means structures which are near to the trunk or towards the trunk, so that are the proximal, and distal means farther from the axial body or the trunk. Example, we will take one example between the wrist and the elbow, okay. So the between the wrist and elbow, you can see wrist is near to the away from the trunk, okay, it's away from the trunk, and elbow is near to the trunk. So what we will say, wrist is distal to the elbow and elbow is proximal to the wrist, okay. One more example we will see here between thigh and the foot, okay. So thigh is, it is near to the trunk, so it will be proximal, and foot are away from the trunk, so it will be distal. So we can say thigh is proximal to the foot and foot is distal to the thigh. Or one more thing, we can see that proximal structures are nearest point of attachment to the limb or structure, or distal point are the farthest point from the attachment or the origin, okay. So the attachment, the origin of the foot is from the groin area here, okay. So it is very far away from its origin, so it will be automatically distal, and the thigh we can see it is near to the origin, so it will be automatically come under the proximal part. Okay, last one we will discuss about the superficial and the deep anatomical directional term. So superficial, if we will talk about, at the name suggests, superficial means superficial layer. So the structures which are close to the surface of the body comes under superficial, and the structures which are further from the surface of the body or deep inside the body, that are comes under the deep structures. So one example we will see here, between the sternum and the lungs. So if we will talk about this rib cage, okay, so sternum is superficial and the lungs are deep, as lungs are in between the cage, okay, and the sternum is the upper part of the rib cage. So sternum will be superficial, while we will compare the anatomical or directional terms for both sternum and the lungs. So sternum will be superficial and lungs will be deep. So this was all about the directional terms or the anatomical terms. So I hope what I have taught you today, you have understood all these things. So if you like my video and my explanation, kindly do subscribe my YouTube channel, and also like my video and comment